Welcome. Thank you for attending this virtual presentation, MCD Public Health Online Opportunities for Professional Development. It's an honor to be here today to present to you. My name is Robin Hetzler, and I work for the organization Medical Care Development in their Public Health Division, which is called MCD Public Health for short.
Hello, and I'm Elizabeth Foley, one of the co-directors of MCD Public Health, and also lead the training team here at MCD.
Before we begin today's presentation, I would just like to disclose that we have no conflict of interest related to the materials covered today. And also before beginning, I want to acknowledge native land. We recognize and honor the tribes who have stewarded this land throughout the generations. We respect the traditional values of these tribes and acknowledge their inherent sovereignty in this territory. A little bit about MCD Public Health. The mission is simply to improve the health and well-being of people. Our commitment is to increase the effectiveness of healthcare and public health systems to help people stay and become healthy. We do this in partnership with communities, organizations, and governments by developing and operating creative, compassionate, and practical programs, by providing technical advice and assistance to enhance the capacity of others. MCD Public Health's scope of work includes programming in the following areas: preventing disease and promoting healthy behaviors, improving healthcare quality and access, and fostering collaboration among people and organizations. The learning objectives for the presentation today are to explain why it is important for CHWs to attend ongoing professional development regarding chronic disease prevention and management, to identify a comprehensive online CHW chronic disease prevention and management training program and know how to access it, and to learn how other CHWs have utilized the knowledge and skills acquired from the training program to support their clients and communities in the prevention and management of chronic conditions.
All right, I think I went too further, so let me go back to the previous slide. Okay, thank you, Robin. I'm going to take over. This is Elizabeth. I want to talk a little bit about chronic disease burden, and as Robin had said in the last slide, some of the objectives that we cover in these trainings includes improving the training and knowledge and resources and tools for community health workers around chronic conditions. As we know, throughout the United States, we have very high rates of chronic disease. We have 6 out of 10 adults in the US that have chronic disease. That is high blood pressure, diabetes, asthma, arthritis, a number of chronic conditions. 4 out of 10 adults have 2 or more of these chronic diseases. Just like I was mentioning, you often may have somebody with high blood pressure, but also diabetes and arthritis. So many folks have a multitude of chronic conditions. And these chronic conditions have high rates of disability, death, cost high rates in the healthcare system. But what can, I'm going to go to the next slide here. What can community health representatives and community health workers do to help their communities and their community members around these chronic conditions? Well, community health workers really do understand the communities that they work in. They understand their clients. They may understand some of the barriers they may be facing. Can they get their medications? Can they afford their medications? Might they have some questions about how to take the medications, how to test their diabetes, their blood sugar? And community health workers can help them with that, also model some of that, and in particular, maybe help them connect to their healthcare provider. They may have questions they want to ask. The community health worker can help them write those questions down and talk to their healthcare provider. What else could community health workers do? Well, you know, they certainly could help them get access to equipment they may need. They may be opportunities to do home blood pressure monitoring, so they could help them get that equipment, whether they get that at a pharmacy or get that through their healthcare provider. And in the trainings that we'll talk about in a bit, you can learn how to use a home self-measured blood pressure monitoring equipment, so they could help them understand how to use it, what time of the day to use it most, how to record their blood pressure, and then how to give that information back to their healthcare provider. Also, how to get other equipment, how to get asthma peak flow meters and use that, or nebulizer equipment for their asthma. And also, one of the important things that community health workers could do is encourage their clients around prevention and wellness. And that includes screening for cancer screening, and really helping them understand the importance of that, and helping, get through some of the cultural issues and barriers to potentially getting screening. So that's something that community health workers can certainly do. And we go through all of those in this community health worker training and give you tools and resources to do this. Before we were asked to develop this online training, prior to developing a virtual training, we used to go all around the US, myself and some members of the team, and do in-person trainings. But we've since moved to pretty much all virtual and online trainings. And before we did that, we wanted to ask community health workers, what do they need? We wanted to get their involvement, both, what they were looking for in a training, and also have them advise us through the process and beta test our trainings and such. So we actually, at the time, had 400 community health workers in a database and surveyed them. We actually have 4,000 community health workers in our database now, but back then we had 400, and we surveyed, and we had 72 responses. And I'm going to just give you a little bit of some of the responses and what they were looking for in a training. So we asked them, where do you do most of your work? And a good portion said health centers, clinics. We had community organization, public health departments, also some in homes, hospitals, a small amount in work sites. And then there was other were mobile health units, telephonic care, and I'm sure there's more now in telehealth with the issues with the coronavirus and folks doing a lot of telehealth. So I'm sure that may have grown since then. But these were some of the areas where they were working the most. And we asked them, what activities do you currently do as a community health worker? So we could understand, when we built the resources and educational tools, what they might need. And a significant portion, 76% patient education. Also refer patients to health services, help patients with goal setting. They work, current activities, work as a member of the healthcare team, do home visits, follow up with clients after medical visits, help get medical equipment. So some of those things I was mentioning earlier on, I think we also see that they help patients do self-management and help them understand their medications. And some also do translation and interpretation. So we really wanted to get an idea of what folks were doing as activities and what kind of supports they may need. So what were some of the biggest barriers that a community health worker may be facing? And one of the top things that they said was not enough support. They didn't mention explaining their role to the patient, which didn't have as many. The other issue was really explaining my role to the healthcare staff, or communicating with the healthcare staff. And then right underneath that, you see not enough training. So those three things were very significant to us, because we thought we could really provide more training, but within that training, give folks, community health workers, tools in order to help them talk with and ask questions and become part of the healthcare team, because we know that that can be a barrier for some community health workers. So we actually have some exercises in there, some role playing in some ways that you can work with the healthcare team. We also have some embedded videos where you can see some community health workers working alongside other healthcare professionals. So these were some of the biggest barriers to their work, and some themes. So we asked them to describe 3 things that might help you with those barriers and make your job easier. And a lot of transportation came up, especially in rural locations. That's tough for us to really deal with, but what we could talk about, and also insurance and services for patients. but certainly what we could talk about in there is helping folks understand places to look, or maybe partners or folks that they could partner with to help with social services. So there may be some local folks that they could connect with to help their patients with transportation, or a patient navigator and getting them help signing up for insurances and such. So we go into some of those in the training. But also, again, as I mentioned, clarity of role and relationship to the healthcare team. The other thing that they were looking for is training and certification, and Robin's going to cover that in a little bit, because folks who do this training in New Mexico will get some continuing education credits that go to their certification. And also they mentioned they would like better communication with their patients and the team, and sustainable and stable community health worker positions. So these were some things that we took into account as we were developing our training. Just wanted to mention a couple of quotes that right from the survey that we did get. And they said in training, we would like to have some disease-specific training. We want training for all staff. We want a training to help us understand and share our value and our role to the healthcare team. And then being part of that decision-making process. We wanted help in helping us be part of that decision-making process, and helping understand who the community health worker is and what we do in the community. So those were some quotes directly from that survey. So I think now I'm going to, after getting that input, we spent quite a few months and we worked with the CHWs that participated in that survey to design this, to test this, and it's been running for some time, and I'm going to turn it over to Robin. She's going to tell you a bit more of what goes into these trainings, and I'll hand it to you. Thank you.
Thank you, Elizabeth. So for all the reasons that were previously mentioned by Elizabeth, MCD Public Health partnered with state health departments, as she mentioned, community health workers, content experts, subject matter experts, professional voiceover talent, and certified translators to develop a one-stop shop for online training related to chronic disease prevention and management, specifically for community health workers, called the Community Health Worker and Chronic Conditions Online Training Program. Just a few things about this online training program. It is not meant to take the place of the community health worker core competency training. Rather, it complements it by providing additional education, skill building, and access to resources for the management of chronic conditions. The information and resources come directly from nationally recognized organizations, such as the Centers for Disease Control and Prevention, the CDC, the American Heart Association, and the Asthma and Allergy Foundations of America. This ensures that the information is evidence-based and incorporates best practices in the field. As guidelines and recommendations evolve, we make sure to update our modules accordingly. The training platform itself is designed to be user-friendly. The modules can be accessed on demand and are self-paced and interactive. Downloadable handouts and resources and helpful website links are embedded throughout the training. After completing a module, a certificate of completion is available for download. The online training program is available for free for any participant that lives or works in New Mexico. Plus, each New Mexico participant receives 5.5 continuing education units, or CEUs, when they complete all 8 of the modules. And the example is on the slide right there. Here we have a screenshot of the first slide in Module 1, Community Health Workers and Chronic Conditions Overview, just so you can get a sense of what it looks like. This slide shares an overview of the first 5 modules and what is covered in each. I'm not going to go through what each of the modules covers, because you can pause your presentation and read that for yourself. I'm just going to mention what the titles of the modules are. So Community Health Workers and Chronic Conditions Overview is Module 1. Module 2 is Hypertension and High Blood Pressure. Module 3 is Prediabetes. Module 4 is Diabetes. And Module 5 is Asthma. This slide covers modules 6 through 8, and they cover breast cancer, cervical cancer, and colorectal cancer. Here is a graph that shows the number of completions of modules by all registrants. So as Elizabeth mentioned, we have about 4,000 folks who have registered for this online training program. And the numbers of folks that have completed the trainings are the top. The number one that has been completed by the most people is the overview of the chronic conditions for community health workers, and that's almost 1,700 people. And the three that you see that are in the 400s, the cancer modules, those were added to the training program a bit later than the others. That's why there are a few less folks that have completed those. And I'm excited to announce that soon there will be a new module. It's called Cholesterol Basics for Community Health Workers. And you can see here what will be covered in that. And this will be added at no cost to folks that already have access to this training program. And they will be able to access it, no problem. Occasionally we offer special programming and modules, such as the most recent one we developed for the response to the COVID-19 crisis. And this is designed for populations living in the United States. So here you can see the screenshot of what this module looks like. We developed this training called the Novel Coronavirus COVID-19 Pandemic, originally in English, and then we were able to translate it into Spanish. And I'm also happy to announce that it will soon be published in 4 additional languages, in French, Arabic, Portuguese, and Lingala, with culturally appropriate adaptations for the immigrant and refugee communities. And this particular module, the COVID module, regardless of the language it's in, will be free and accessible to anyone, anywhere. All modules also contain content-based test your knowledge sections that are designed to help participants retain information in an interactive way. There are also evaluation questions at the end of each module. These provide participants with an opportunity to provide feedback about how they will use their newfound knowledge, what they liked best, and what could be improved upon. They recommend that participants provide thoughtful responses to these evaluation questions. We take the feedback very seriously, and it helps us to improve our content. Here is a slide that shows some examples of some feedback that we've received from participants who have completed the modules.
Thanks, Robin. I think it's back over to me, Elizabeth, at this point. We really want to thank you for giving that overview, and we really want to encourage folks to go into the training, to register. That will be, those links will be available alongside this this Zoom webinar. And when you're in those trainings, you'll actually have access to a number of videos or vignettes and snippets of community health workers working with their clients in the community. And so we'd really like to encourage you to take a look at them. Some of them are quite moving and really some great videos. And what we also want to say is we really, we have community health workers all across the US and actually internationally using our trainings now. I think we've reached 12 countries with that. And we actually really do take into account the different populations, the different cultural nuances and such that we need to be looking at. And so we're always open to adapting the materials. We actually have a lot of downloadable resources or links that you can go to and visit that are embedded in those trainings. So if you're ever taking a training and want to provide us some feedback or feedback in that evaluation or get in touch with us, we're happy to take a look and see if we can add more content or add more content that will work with the communities that you serve. An example, as Robin was mentioning, we do develop community health worker trainings in other languages, and we work very closely with CHWs to help us translate those and also make sure they're culturally competent and actually help us deliver some of that, some of those language on our trainings. And so just opening up, we would love to work with you. We would be honored to collaborate with the NAP program and to really provide any other adapted needs that you might have to these trainings. So once you get in there and look at them and get your 5.5 continuing education credits for that and certification. And again, we should mention, and I'm sure Robin did, but if you do go in and you're taking the trainings, they're self-paced. You can leave and go back in and it will take you back to the spot that you were before, or you can start them over, but they're really self-paced and you can take them in any order that you'd like. And I think this would be the part that we would ask you some questions. That said, since we're not quite live at this point, we do have contact information, myself, Elizabeth, Robin, who works on my team, and the link to visit the site and to look at the training content and the videos, and get in touch with us if you have any recommendations or questions. We're here and we'd be excited to work with you. So I think at this point, unless Robin, you have anything else you'd like to add, that wraps up our presentation of our community health worker online training resources.
Yeah, just thank you for your time, and please check out the training site. And if you ever have any questions about it, feel free to email either one of us.
Thank you very much.
Thank you.